This video for educational purpose, not for treatment. Diabetic mellitus treatment. Goals in diabetic mellitus. If the patient is pre-diabetic, then HbA1c goal is less than 5.7%. If patient is diabetic, then HbA1c goal is less than 7%. Pre-diabetic treatment have two methods of treatment: lifestyle modification and medication. One is lifestyle modification by losing weight, healthy diet, exercise, and quiet smoking. In losing weight, lose 7% of total body weight by decrease 500 to 1000 calorie take per day. In healthy diet, take fruits and green vegetables, avoid saturated fat, and avoid sugar containing foods, avoid processed food. In exercise, increase the physical activity and 30 minutes of daily exercise, or 5 days in a week, and also quiet smoking. In medication, start with the low dose of metformin. Mechanism of action is decrease the insulin resistance. Adverse effect of metformin is nausea, diarrhea, lactic acidosis. So it is lactic acidosis. So it is contraindicated in the chronic kidney disease and heart failure. Metformin also causes the vitamin B12 deficiency. For assessment of change in hemoglobin and hematocrit values, CBC, complete blood count test, is important in metformin medication. If the patient is diabetic, then also have two methods of treatment. One is lifestyle modification and second is medication. Lifestyle modification is same as the pre-diabetic patient, but in medication, if the patient have first test have HbA1c greater than 10%, then directly start insulin therapy. If the HbA1c is less than 10%, then start first drug is metformin. Start with the low dose of metformin in 5 mg with the evening meal. If patient is tolerated, then add 500 mg in breakfast. It increase one tablet by 2 or 3 weeks. Effective dose of metformin is check after 3 months. If HbA1c is still higher than the 7%, start second medication, which depends on the patient individual factor. Patient is overweight, or chronic kidney disease patient, or heart failure patient, or atherosclerotic cardiovascular disease patient. Second drug is sulfonylureas. In sulfonylureas, glimepiride and glipizide. Mechanism of action is increase the insulin release from pancreas. Adverse effect of sulfonylureas is hypoglycemia and weight gain. It take 30 minutes before the meal, and also is contraindicated in chronic kidney disease, but it helpful in heart failure patient. Third drug is thiazolidinediones, pioglitazone. Mechanism of action is decrease insulin resistance and also decrease the hepatic gluconeogenesis, glucose synthesis from fat and protein, ultimately decrease the blood sugar. Adverse effect is weight gain and contraindicated in patient with heart failure. but it could improve the cardiovascular health and helpful in atherosclerotic cardiovascular disease patient. Fourth drug is SGLT2 inhibitor or dapagliflozin. Mechanism of action SGLT2 inhibitor is inhibit the sodium glucose co-transport in kidney and increase the excretion of glucose, ultimately decrease the blood glucose. Adverse effect of SGL2 inhibitor is hypoglycemia, contraindicated in chronic kidney disease patient and beneficial in atherosclerotic patient. Also help in weight loss. Fifth type of drug is antidiabetic medications, which depend on hormone GLP-1 hormone, which is decrease glucagon and increase insulin production, ultimately decrease the blood glucose. It have two drugs, GPL1 analog and DPP4 inhibitor or gliptins. GPL1 analog is act like GPL1, but it is contraindicated in chronic kidney disease patient and used in cardiovascular atherosclerotic disease patient and diabetic neuropathic patient. DPP4 inhibitor act by stop the degradation of GPL1 hormone, and it is useful in chronic kidney disease but contraindicated in the heart failure patient. Treatment process: diagnose the diabetes and prediabetes. Start with the lifestyle modification and metformin. After the 3 months, if still HbA1c is greater than 7%, then second drug start sulfonylureas or liraglutide. After 3 months, if still greater than 7% of HbA1c, then start third anti-diabetic medication according to the patient health condition. And after 3 months, if it is still 7% or still the blood glucose level HbA1c test is greater than 7%, start insulin therapy. Insulin therapy test, if the initial test have greater than 10% of HbA1c, then start directly insulin therapy. Next video is insulin therapy.